It did. Okay. Looking at the bill we received after the birth of my daughter, we were flabbergasted. A bill of a whopping $42,000 was charged to my health insurance company. Not only were the charges outrageously high, the hospital tried to charge the room twice, once to my wife and once to my newborn daughter. Today's healthcare expenses are continuing to outpace inflation. In 2015, Forbes said there was approximately a 0% inflation rate and a 3% increase in healthcare costs. There are a few things we can do to fix the problem, such as requiring providers to post pricing information, create an online search program, and increase the supply of medical professionals. This is important to you because medical care is a need we all require. Today, we will go over the rising cost of healthcare and what I believe we can do to help, such as increasing competition and how it would look for healthcare services, procedures, and medications in the future. Let's look at what's going on. Today's medical bills have become very unaffordable for the average person. Showing up to the ER or the doctor should be somewhat expensive because doctors and nurses are specifically in demand. But it should not be to the detriment of society or cause a person to go bankrupt or make payments for the rest of their life. This is particularly true for emergency visits. Traditional insurance companies, hospitals, Medicare, and Medicaid have driven up the cost of services because they require real estate, personnel, lawyers, but most of all, profit. As you can see from my story, a routine procedure that is done 10 or more times in a day at that particular hospital with equipment that has been around for more than 50 years still resulted in an astronomical bill. According to Johns Hopkins University, one hospital in 2017 posted a profit that averaged $4,241 per patient. Government assistance can also put an increasing strain on the system, driving up prices. As the government gives out healthcare subsidies, more people put a strain on the system. This is especially true of lower income families, as they tend to need more expensive healthcare because affordable preventative care is not available in their area. Aging population and improved technology are also increasing costs. As technology becomes better, people tend to live longer and longer. However, when you get older, you need more medical care. With the average age of the population increase, we will continue to see a strain on the system. For the first time in U.S. history, adults will be more populous than children. According to the Census Bureau, by 2060, 1 in 4 Americans will be over the age of 65. As the age of the population increases, medical costs will as well. Research and development will also be a rather large cost when developing new technology in medicine. As technology gets more complicated, you need more resources, a cost that will always be passed on to you, the consumer. 5% of all care is research and development, according to Statista.com. Although the cost of healthcare is increasing, there are some things we can do to help. I believe the best way to drive down cost of healthcare is to increase competition by requiring all providers to publish pricing information and encourage new medical professionals to get into the field. We also need a more efficient system to be able to search for the care that we need. Increasing competition is key to driving down prices in nearly all industries. By requiring providers to publish pricing information that is easily accessible to the consumer, they have a choice on who they see based on price. This is at least true for non-emergency situations. This should increase competition by driving the consumer to the lowest possible price option. We also need to push for doctors, physician's assistants, and certified nursing practitioners to start their own practices in low competition areas and incentivize them by paying off their loans after a certain number of years, thereby increasing the overall supply of healthcare professionals. We also need the sufficient search system to allow consumers to search for medical care services that they need. You would know exactly what it costs before even showing up to your doctor's appointment. Currently, I can hop onto Amazon and find nearly any product made in the world today. We need a system where I can search by location, care, and cost. You could even integrate insurance into the system. After finding the doctor or care that you require, the website runs your insurance parameters and you will know exactly what it costs with or without insurance. In the future, I envision healthcare being accessible to more and more people. In a world where the measures I spoke of, such as transparent pricing, an online system, and encouraging more medical professionals to get into the system, there would be less confusion and chaos surrounding healthcare. Forced transparency alone people would figure out what procedures they can afford and what they might need to save up for. Regardless of the outcome, there would be a healthier population due to reduced fear of medical bills. Knowing the cost of procedure before it is performed is an immensely beneficial tool. And if it is adopted, it will allow natural competition to arise in the medical field that does currently not exist. There are not many options to shop around when an issue arises currently, but if this model is adopted, that would change. If it is not adopted, we will continue to receive surprise medical bills that make little to no sense. If the previous solutions are adopted, the abundance of medical care providers would grow and create a healthier population, a larger web of doctors, physician's assistant, and certified nursing practitioners, especially in underprivileged communities where big hospitals are not currently present. The efficient care system I envision would completely change the consumer side of medical care. I envision a future which you log onto a massive search engine and filter through location, care, and cost, taking only minutes to find what you need. The most ambitious of these plans is to integrate insurance into the system. I envision the system to allow you to save your insurance information so that codes the insurance company uses and often rely on will give you more accurate pricing. To top it off, I believe there's a big issue with our healthcare system, and there are a few steps that will help curtail the cost and confusion surrounding it. Healthcare expenses are increasing, and there are things we can do to help fix this. Increasing competition. In the future, you will shop online for services and medical care just like you would for items on Amazon, with transparent pricing and an increase in overall professionals available. The best way for this to happen is for you to contact your congressman about these changes. I hope that you never have to deal with extraordinary health bills that are crippling to you or your way of life.